Say your loved one goes in the kitchen and they put something on the stove. Say they put a paper plate and they cook while the paper plate's on the stove. Well, it's time for that person to stop cooking. Say they take a piece of foil on top of a pan and put it in the microwave. Well, it's time for that person to stop using the microwave. So it's going to be individualized for the individual, and you can't just blanketly take everything away. Take things away gradually. One thing I tell caregivers all the time, and I think is very helpful, is to think about starting your loved one at age 12 and going back to 0. Now, what happens at age 12? At age 12, they're pretty independent. They can do things for themselves. They go out and they play. You may call them into dinner. You may let them skip it. What do you do at age 8? Well, you call them into dinner. You make them sit at the table with you. You say, make sure you eat all your food. What do you do at age 4? Well, now you say, oh, now you make a game of you're gonna put the vegetables in their mouth. No, gotta eat 2 bites, 2 more bites, and then you make a game out of them eating. What do you do at age 2? They're sitting on your lap while they eat. What do you do at age 0? There's a bottle in their mouth, and you're doing everything for them. If a person with Alzheimer's disease lives long enough, they're going to go through those stages, even back to the fetal position. They're going to forget how to eat, drink, do everything, even all the way back to the fetal position. So I personally have lots of experience working with patients as well as family with dementia and Alzheimer's disease and Parkinson's disease. So I've got some significant background from which to make these type of statements. And if you can get a handle on that there will be a downhill progression from like 12 to like 0, that will also help you in helping your loved ones, taking care of them. The other thing, as you're taking away their independence, try to replace it with something. Try to give them something back as you take something away. Choices. This is one of the areas where families have a lot of trouble. The mother has 100 dresses in the closet and 500 pairs of shoes. And they say, Mom, which shoes you want to wear today? Which dress you want to wear today? No, don't do that. You want to begin to help them out with that. You want to say, Mom, I think these blue shoes will go nice with the red dress. As opposed to telling them, you're kind of making a suggestion. And then you'll get to the stage where you need to clean the closet out and maybe have 1 or 2, 3 outfits at the most in that closet. And when they look in the closet, now they've narrowed their choices down. This is going to be easier for them so they don't have as many choices. And then you'll get to the place where maybe you just put the dress and the shoes out on the bed. This is what we're going to wear today. Well, Mom, this will look great on you today. So as opposed to telling them, Mom, this is going to look so good on you today. So they think it's kind of their idea that they want to wear that today. Remember, the more choices you begin to give a person that has dementia, the more frustrated they get because they have trouble with choices. So you don't say, what do you want to eat tonight? Do you want chicken? Do you want hot dogs? Do you want bacon? Do you want tomatoes? Whatever it is. You don't give them all those choices. You say, oh, man, those tomatoes look great. Let's have tomatoes and a salad, and I think we'll put a little chicken in with it. So you do it that way as opposed to giving them choices. And you're not telling them so much. Because nobody likes to be told. Nobody likes for their options to be taken away. So you want to be a little more subtle about that. What do you do when you're trying to get your 5-year-old convinced that they should do something they don't want to do? You make a game out of it. You make it fun. For example, my boys weren't 5, but I had 2 instruments around my house. I had a flute and I had a saxophone. So what instruments do you think my boys learned to play? And, kids oftentimes don't want to do something because you told them to do it. So I would let them see me play the sax, let them see me play the flute. Oh, man, I'd say, listen how this sounds. Watch how I play this. Here's something on television. I say, oh, I can play this like them. And then what does the kid say? Oh, can I play? Can I do that? He said, sure, you can do that. And then once they start playing, oh, man, you're playing that so great. I think we better get you some lessons. Before you know it, you got your kid playing the flute, got your kid playing the saxophone. And they think it's their idea, but it was really your idea. And that's the type of creativity I'm suggesting you need to have as a caregivers as your loved ones get coming down with dementia. Again, I'm emphasizing that one of the biggest things seniors don't like is if you're taking away their rights, taking away their ability to do things. Mom's always paid her bills on time. Mom's always done all these things. I can't take her bills away. Mom's real dependent. She doesn't want to live anywhere else. You got to be subtle about it. But then if you see that they're going to hurt themselves, then you just got to, this is the rule. This is the way we're going to do it. And that's important too, that you have to be willing to do that. I associate this with hurt because it's hard for you to take away, the caregiver, for you to take away your loved one's rights. They're independent. You don't want to take away their independence. It's hard to do that. So If you associate it with safety, it'll be easier for you to do that. So now you've taken away some of those rights and you're helping the person live a little safer. Now it's going to come to a place, where does the person live? Does the person live with me? Does the person live with my mother, my brother? Does the person have to go into a nursing home, assisted living? All of these factors are going to come into being. And the sooner you start thinking about these things, planning them out, the better you're going to be.